Hello everyone, welcome back to All Round Health Talk. Well, you know who it is. It's me, your favorite health blog, Dr. Onyinye. Well, before we go into today's question, remember to subscribe to this channel, like, share the video, and most importantly, I want to hear what you think. I want to hear your questions and your doubts, so please leave them in the comment section. So, you ask and I answer, and I've gotten a question where people say, is there any need for me to continue taking my medication after I feel better? Well, sometimes your doctor might prescribe you a medication for an infection, maybe antibiotics, antiviral medication for an infection or a gastric problem. Or maybe you're suffering from a chronic disease like high blood pressure and you have to take your medications every day. You get to a point where you start feeling better and you think that there is no need to continue the medication. Well, today I'm here to tell you that you always have to complete your medication. Even if you feel better after 3 or 4 days of taking your medication, you must complete your medication. If your medication has been prescribed for 7 days, 10 days, 15 days, or for life, you always have to take your medication based on prescription, no matter how you're feeling. So what happens is that if, for example, your doctor has prescribed you a medication for an infection, and after 3 days of taking the medication, you feel better and you stop taking the medication, you have a very high risk of having that infection again. So the medication that is given is for the infection to be completely treated so that you don't have to have that infection again. So if you stop the medication halfway, the medication has not completed its work, so you're going to have the infection again. Also, if you take antibiotics, especially antibiotics, without completing them, you take them for 3 days, and then the next time you have the infection, you take it for another 3 days, it will cause something we call resistance. So when you're actually very sick and your body needs that antibiotic, it's not going to function because now your body is resistant to it due to your abuse of that antibiotics. And in the case of high blood pressure and every other chronic disease like diabetes, you always have to take your medication. Chronic disease means there is no cure, there's only medication to control it. So those treatments are for life. I've had patients who take their blood pressure medications every day and they go for regular checkup of their blood pressure and they notice that their blood pressure is normal, so they feel like there's no need to keep taking the medication, right? Because they feel the blood pressure is normal. They stop taking the medication, and after some weeks of not taking their medication, they start having a headache, chest pain, and they start feeling unwell. Now they are worried, why am I feeling this way? The problem is that you've stopped taking your medication for the blood pressure. What your blood pressure medication does is to control your blood pressure. So the only reason why your blood pressure is normal is because you're taking your medication. If you stop taking your medication, your blood pressure skyrockets again, and it could be bad. It could cause heart failure. It could cause so many complications. So always remember, diseases like blood pressure, high blood pressure, diabetes are chronic. Even there are patients who have asthma and they think that because they don't have any more asthmatic crisis, they are cured. Those diseases are chronic, so medication has to be for life. So take it from your experts. If you have been placed on a medication, please and please complete the medication. Even though you're feeling better, make sure you complete your medication. Okay, so this is the question I have for you today, and I hope that this answer helps you in the next time you're taking a medication or helps you with a friend or a neighbor. Please share this video to other people so that they can hear what I just said. It will help them a lot, okay? And also some thumbs up to support me, and leave me your questions in the comment section. I really want to be able to answer your questions. And please subscribe. We need subscribers, okay? We need to get this information to more people. Thank you for being with me today. I'll see you in the next video. Bye.